covering the community, events, and people of Georgia, Carolina. This is the Means Report. Here is Brad Means.
Hello everybody, and thanks for joining us. We appreciate you being here, spending part of your really what feels like a springtime Sunday with us. There never has been a wintry day to speak of since probably last winter, and so I really appreciate you taking the time to sit inside and watch television right now, because I think the world is just outside celebrating this picture-perfect weather that we enjoy in the Georgia, Carolina area. And we're going to talk about a couple of great topics today to keep you in that good springtime mood. The first one has to do with your health. You know, we're big on that on the Means Report. It's Colorectal Cancer Awareness Month here in the month of March, and we're going to talk about some very simple ways that you or your loved ones can stay in the best shape possible and hopefully avoid colorectal cancer. Also today, a tribute to the past in a very, very beautiful way. You're talking about an art form that is several centuries old, and it's being recreated in the form of baskets and jewelry that are available right here in the CSRA. In fact, they're available now all over the country, and they are created in the Low Country area of South Carolina. You'll be amazed to see them and even more amazed to hear the story behind these beautiful pieces. A special guest is on the set of the Means Report to talk about that. First though, let's get right to Colorectal Cancer Awareness Month. Dr. Sunil Law is here from Doctors Hospital. He's a gastroenterologist. And Dr. Law, thanks for taking the time out of your busy schedule.
Thanks for having me aboard.
When I say busy, because a lot of people probably come to you with signs or symptoms of colorectal cancer because they didn't get screened. And so I want to talk about the importance of screening right off the top. Last time I checked, you were looking at maybe 60% of people who needed to be screened getting screened. That's not good.
No, we really want to strive for 100%. And the reason is that colorectal cancer screening can save lives. It is a preventive way of people to keep them from getting colon cancer.
But there's such a fear factor there because of worries about the invasiveness of it, perhaps the discomfort of it. Can you just speak to the screening process? Just walk us through it, maybe.
I mean, I think that the most difficult part is the preparation for the colonoscopy procedure, but we've come out with a lot of different formulations of preparation. And generally, it is prescribed with medications that reduce nausea. But once the preparation is done for the test itself takes about 10 to 15 minutes. It is done with anesthesia or with sedative. So there's very little to no discomfort at all to the patient.
Are you talking about local anesthesia, or do you knock the patient completely out?
In general, we use, there's several medications that can be used: Versed, fentanyl, or propofol. These are medications where the patient generally is put into a twilight sleep or completely knocked out, but they do breathe on their own.
And the preparation, if you can get past that part, then you're home free pretty much, it sounds like.
Absolutely. I mean, after that, the patients come in, we place an IV, and the test itself takes about 10 to 15 minutes on average to run on an individual.
Can you watch the procedure on a video screen?
Generally, patients do not watch the actual procedure because they are completely knocked out for the procedure itself. What
are you looking for? Are you looking for just polyps, hopefully in their very early precancerous stages? Are you looking for other things?
Well, I think as part of, it is a complete and thorough examination. In terms of colorectal screening, we are obviously looking for polyps. The nice thing about the test is that during the procedure itself, if someone has a polyp, we can remove it at the time, generally speaking, during the procedure itself, and hence getting rid of the seed that can actually turn into cancer.
What are some, okay, let's say we're in that 40% who has no time and no inclination to get screened, and we're at home and we're watching this. Are there signs or symptoms of colon cancer, colorectal cancer to look for?
You know, that's a real good question, and generally there are signs and symptoms that are affiliated with colon cancer. Those can include, but are not limited to, rectal bleeding, difficulty or changes in bowel habits, weight loss, to just name a few. But what we don't want to have is where people actually get to the point where they have these symptoms, because it can be indicative of more advanced disease.
Would you find that in most cases, and I don't want to make anybody think that this is worry-free, because we are talking about cancer, but in most cases, Do you find that either you find nothing or you find polyps that you can clip right then and there?
Absolutely.
Really?
I think about 95% of the time patients do very well. We have some small polyps that we take out. And again, it's a real important test to have done because it is a preventative test.
My dad and stepmother had their colonoscopies together. I laughed at them at the time. Do you ever see people partnering up and going through the procedure to kind of strengthen numbers?
Absolutely. We have people that come in as partners. They come together, and I think that's great because they encourage each other to do the prep and to have the test done.
I'm sorry for interrupting. What causes this disease?
You know, there is a definite genetic predisposition to it as well as an environmental component. And you can look in the literature and people will say, well, if I eat a certain diet or do certain things, it can reduce your chance. But again, it is not sufficient to eat a particular diet and say, well, because I eat so well or I'm so healthy that I don't need to have this test done.
A lot of people do think that. They think they can just
Right.
eat the proper foods and then be cancer-free.
Right.
What's the magic number? Are we still talking about 50 and up?
Well, and I think this is really what's very important to delineate and to make clear is that it's not so much about a number. I think that the average age should be about 50. However, if somebody has signs and symptoms, as we talked about earlier, or a family history, they really need to consult with a physician and have it done earlier. Because I have detected colon cancer in individuals as young as 30.
As 30.
Yes, sir.
Is this something that can be spotted during a regular physical examination? Can your family care doctor at least see the need for you to go further and go see a specialist like you, or do you have to go straight to you?
Well, I think what they used to do on routine physical exams were rectal examinations where they would check for blood. Mm-hmm. But I think what we have found with time is that doing those rectal exams and checking for blood is not a very precise way or a very necessarily useful way of telling or establishing whether someone has colon cancer or not. Because with those tests come with them a lot of false positive tests where the tests come back positive or negative and the patient can still have cancer.
Can any of this screening, I know you can't go in depth at home, but can we do anything at home to try to make a determination as to whether we need to come see you or not, especially for those of us under 50? Any home screenings?
No, I think that the most important thing is to just be educated.
Yeah.
And you know, I know it's not a very gentlemanlike conversation during dinner, but I think we have the responsibility of educating our neighbors and families and friends, and there's really not a great way to screen at home.
Tell me what you're looking at. Let's look at the other side. Mm-hmm. Let's say that the screening did not go as smoothly as you had hoped. What about the treatment of colorectal cancer? What's involved there?
Well, I think it's where the stage is, the stage of the cancer.
Mm-hmm.
Let's say it's a more advanced polyp that's not amenable to resection with a colonoscopy. Even if it's a larger polyp, we have colorectal surgeons that now do minimally or less invasive colon resection, and you can still have a survival rate as high as 80% if it's just caught in time.
I tell you, if the words that you've spoken today don't help people get over their fear, then nothing will, because it sounds a lot less stressful than I thought it was before this interview.
Right.
Do you find that patients very quickly, when they come see you and they're finished, say, that wasn't so bad?
A majority of them say that really wasn't that bad, and I'm really glad that I had it done, especially if we take out polyps or we save their life by detecting colorectal cancer early.
I tell you what, there's no reason now for you not to go see Dr. Law or another physician and make sure that you get that colonoscopy done and done quickly. Doctor, again, I know you're busy, and I hope that you're busier after this, and I appreciate you so much.
Thank you for having me.
All right, gastroenterologist Dr. Sunil Law from Doctors Hospital. Go see him. It's Colorectal Cancer Awareness Month. Doctors has all sorts of things going on to help you deal with that screening. Take that first step and get over that fear. It is well worth it. Hey, have you ever heard of interpretive basketry? Well, you're about to. It's a fascinating art, and it's producing some fascinating products for you to get your hands on. We're going to talk to a very special lady who has come to us all the way from Raleigh, North Carolina to be on the Means Report. Does my voice echo in this studio? I think it echoes in our new studio. Anyway, the Means Report will continue in just a moment.